Hey guys, welcome back to my YouTube channel. I kind of stumbled on putting this video out. I just had been having a difficult time kind of conveying my words and just kind of bogged down with emotions from kind of revisiting Sevi's journey. So this video is going to be about Seven's diagnosis. So I'm just gonna jump right in. So I had started my prenatal care at 8 weeks. We found out that we were pregnant with Seven about 4 weeks. So pretty early on. So I started seeing an awesome doctor, and I was really happy with like the care that she was providing. But the only thing that I was kind of having a hard time with or a hang up on was she was not pro VBAC, which VBAC is a vaginal delivery after a C-section. So just with my medical history, having had, prior C-sections, she just didn't feel comfortable with attempt a VBAC procedure. So I had kind of searched around to see if there was any other doctors in my area that would be pro VBAC, and I happened to find one. So I scheduled an appointment with him, went in for my first appointment, and he went over all of my medical information, and he thought that I would be a perfect candidate for the VBAC. So I was feeling amazing. I went home and told my husband, and I was just feeling super encouraged and excited. And so I had called to schedule my next appointment, and at this point I was 20 weeks along. And so they said, hey, we need to get you in for your anatomy scan. I was like, okay. So we scheduled the anatomy scan, and we just so happened to be able to have the appointment on Friday before Christmas. So my husband and oldest daughter got the day off of work so that they could go to the appointment with me. When we got to the doctor's office, the lobby was completely filled with whole bunch of patients, and they ended up not calling me back for about 45 minutes past my appointment time, which was kind of annoying, but I could see that they were clearly super busy, so I didn't, make a big deal. So I get back to the room, and the ultrasound tech, she, tells me her name and asks me to lay back and gets me prepped for the ultrasound. She puts the jelly on my stomach, and as she is beginning the ultrasound, she actually gets called away by the doctor. So she steps out, comes back in, and gets, going with my ultrasound. And I had, 4 other babies, so I'm not new to anatomy scans and what they all involve. So she starts the scan, and she first says, would you guys like to know gender? And we said, we found out early on it was a little girl. And she said, yep, it's still a little girl. So we all just kind of laughed. And then she starts at Seven's head, and she kind of pauses, and it feels like a eternity. And then she goes to Seven's heart, and then she goes back to Seven's head. And having had prior anatomy scans, I know that the ultrasound tech is there to look at things and measure things and make sure that dates are correct and that everything looks good and all that good stuff. But something just wasn't feeling right. Something felt completely off. And so she, after what seemed like forever, says, well, the anatomy scan is to see if there's something abnormal, and I'm seeing something abnormal. And so I'm just shocked, because this is an exciting time for me, my husband, and my daughter to see sweet little Sevi, and we totally weren't expecting this information, so we're like, okay, so what does that mean? And she says, well, the doctor's in an emergency surgery right now, so you would have to wait until he's done and discuss that with him. So I'm just thinking in my head, okay, so you just told me that you see something abnormal, and now you're just gonna leave me high and dry without any details? I mean, so we are trying to really get information, or as much as information as we can at this time, without the doctor being there. So then we ask her, well, what abnormality do you see? And she says, your baby has water on her brain. And we're all just stunned. I can't even think. I can't speak. I don't know what's going on. I'm just completely speechless. So my husband asks her, so what does that mean? What does water on the brain mean? And she said, well, again, you're going to have to wait until the doctor can discuss that with you. So we then proceed to kind of ask the same question, but ask it differently, and just, ask her, so with water on the brain, what could that potentially mean for a baby? And she says, well, it could be a number of things. It could be, hydrocephalus, genetic conditions. It could be a number of things. So now I'm really, really upset. At this point, I am just crying. I don't even know how to process anything that's going on. So she asks me, she puts a complete halt to my ultrasound. She stops doing the scan completely. I didn't get a picture of 7. I didn't get anything other than just trauma. So she asked if we wanted to wait for the doctor to discuss things further, which we said yes. So she transfers us to a room across the hall and shuts the door. So we wait in this room for about 30 minutes until my daughter grows very impatient and goes up to the front desk and just asks the receptionist and the ultrasound tech, is there any status on when the doctor's going to be here? And the ultrasound tech just says, well, I sent over a referral, and you guys are just going to have to see a specialist, and just leaves us at that. So my daughter comes back into the room to tell us that, and I'm just thinking, okay, so we're just sitting here waiting with no follow-up, and it just was complete horrendous bedside manner. So we leave, and I just remember leaving and just looking up in the sky and just thinking, what does this mean? Because at this point, we still had so many questions. There was just like a big question mark. So we obviously know that the ultrasound technician seen something that is abnormal, but we didn't know what it was. So this was the Friday before Christmas, and Christmas was that Monday. So we knew that we were going to have to wait until Tuesday when the doctor's offices open back up to potentially get any more answers. So I had to go home and, put on a smiley face for my kiddos. With it being Christmas, I didn't want to take any of the joy away from that time. But I just remember opening up gifts for 7 and just being like overcome with sadness. And so that following Tuesday, I had called the doctor's office to see if I could possibly get more answers and possibly talk to the doctor, which they told me that he was out of town for the holidays, but that they would take down a message. So I ended up probably about an hour later getting a call back from the doctor, and the doctor just apologized that he was not able to speak with me on Friday, and that from the things that he was told from the ultrasound technician, it does appear that the baby could possibly have trisomy 13 with the markers that he was seeing. And I asked him, what is trisomy 13? I had never even heard of it. And so he just said, it's when a baby has a duplicate 13th chromosome. And so instead of the 2 chromosomes, the baby has 3. And that with that 3rd chromosome comes abnormalities and anomalies that vary depending on, they vary from each baby to the next. So I'm like, okay. So he goes on to tell me that a referral was sent over to maternal fetal medicine, and that I would need to get in to see them for a more in-depth ultrasound to really see exactly what's going on. So I got a call from maternal fetal medicine on Wednesday, and they said that they had received my referral, and they asked if I would be available to come in for a ultrasound at noon. And I told them absolutely. I called my husband to let him know that they got me in for a same day appointment at noon, and he said, that he was happy that they could get me in so soon, but unfortunately he wouldn't be able to leave work. So I had to put on my big girl pants. I had to go to this appointment by myself. So I remember driving to the office, and the entire drive I was crying and I was praying. And when I got to the office, the ultrasound technician called me back. She told me right away that, she would be doing an ultrasound that would take about an hour long, and that she would be doing measurements and looking at certain things, that if she sees anything abnormal, she wouldn't be able to disclose the information with me, but that the doctor would be in after my scan to go over everything in depth. So I got to see sweet little Sevy on the screen, and I just remember laying there and praying during the scan. And so after my appointment with the ultrasound technician, the doctor came in and introduced himself and said that he had reviewed the scans in the back and that he wanted to go over the information with me. So he asked me if I was in the office with anyone, and I told him no, I was alone. And so he just told me, the things that I'm going to be going over are going to be really hard to hear. So he pulled up the images on his screen and started to review them with me. So the first image that he reviewed was her head. He said her head is small, smaller in size than we would like to see at this gestation. And then he went to her face, and he said that she didn't have eyes, that she had eye sockets, but that there are no eyes in there. And that it did appear that she did not have a nasal bone, that she had a cleft lip and palate, and that her heart did not show the 4 chambers. So I feel like after he just showed me every single thing that was going on with Seven, I felt like my whole heart was just crushed. So I just remember afterwards him telling me that with the anomalies that he was seeing, that it could be, but of course he wasn't sure, it could be trisomy 13. And he did explain that there's 2 tests to get further information, that we could do an amniocentesis, which is nearly 100% accurate as far as the results are concerned, or that we could do a non-invasive prenatal test, which would be a blood test. So I told him that at this time I'd like to do the blood test. And so I remember just crying, but trying to keep it together because the information was so fresh and new, and I just didn't know how to kind of even process any of it. I remember him grabbing my hands and asking me if he could pray with me. And that's something that I will never ever forget. I had just met him, and he knew that I needed it. He knew I needed the prayer. So after the appointment, I went up to the lab to get my blood draw, and he did tell me that the results would take about 10 days to get back. And so when I left the doctor's office, I had to make one of the hardest phone calls that I've ever made in my life. I had to call my husband and tell him about our little baby girl. And I just remember us sitting on the phone and just weeping, just crying, it was so hard to understand. So in the days to follow, before we got the results back, it was really, it felt like a really dark time. There are some moments where we kind of just question things, and although we're very strong in our faith, it just was such a hard time. We prayed for complete healing. We wanted the results to come back from the blood test that everything was fine, you know. So I remember getting the call from the doctor. He actually called on the 10th day and just asked me if it was a good time to talk. I told him yeah, and he said, well, I got the blood test results back and your baby girl does have trisomy 13. That was hard to hear. From the moment that I found out Seven's diagnosis, I just started researching it up. I joined Facebook groups. I just started reading up online about the condition, and the information that I found on Google wasn't very positive information, but the information I found on Facebook with the groups that I joined blew my mind. I was told that, you know, these babies' survival is very low, that most of them don't survive the pregnancy, let alone after birth. I just remember thinking about my baby and thinking about the information that I was given, and just remembering that I was her mama and that we were in this together, that I was going to do everything that I could to maximize all of the time that I had with her. I know that when I had gotten the diagnosis with Seven, I searched on YouTube for a lot of videos, and I remember wishing that there were more. I know that this video is a bit of a lengthy one, but this is the raw, uncut story of Sevi's diagnosis. So I just wanted to put this video out. I know it's pretty apparent that this was a difficult video for me. It's really hard reliving the moments with Seven. Although I do relive these moments constantly in my brain, it's really hard to put the words out there and convey them. There needs to be more awareness around trisomy 13. So I look forward to sharing more of that in my future videos. My next video I plan to do about my pregnancy with Seven. If you are a trisomy mama that is going through this, I again want to let you know that there's so much hope. You know that a lot of the information that the doctors go off of is outdated, and I found that firsthand just by joining several Facebook groups with living trisomy kids and adults. So there is so much hope. I look forward to sharing more of my journey with Seven with you all, and I will see you all on the next video. All right, bye guys.